Yeah, sure. So my name's Stephanie Hill. I am a clinical academic. So I am an ST3 Palliative Medicine Registrar and do my academic clinical fellowship with the Hull York Medical School. And along with my academic clinical fellowship, I am undertaking a master's, and that is a master's by thesis in medical sciences.
And why did you choose to study the implementation science module?
So my area of research is looking into palliative care within the ICU. And after looking through some of the research that is already ongoing, it became very apparent to me that actually the sort of crux of what's going on at the moment is how interventions to improve palliative care in the ICU are actually implemented. There's been a fair amount of work done on the interventions themselves, but what's lacking is how do we actually get those from research into practice? And as somebody who's been working clinically, that is sort of the side of things that I see at work as well. So in my own clinical career, I've seen a lot of things come and go that have been maybe had some strong evidence behind them, but because there's been no sort of appreciation of how that can be integrated into clinical practice in terms of what the people on the ground actually would see as feasible or manageable, they just haven't stuck. So it just spoke to me in that sense. And I wanted to take the module to have a better understanding of some of the more complex things in terms of implementation science, because it's quite a academic subject, I would say, especially some of the terminologies that are used. It's almost a different language, and I really wanted to be able to get stuck in with some good support to understand that, as opposed to trying to teach myself.
And so how did you find the module? What do you think you gained from it?
So I can't speak highly enough of this module, and I can compare and contrast it to other modules that I have done, both within my master's and previous to that with my other degrees. I felt completely supported throughout and sort of led through the process, guided through the process, so that my own work was more structured, and I felt like I wasn't wasting any of my time. It was all used in the right way towards supporting my learning. What I found most useful was right at the start, it was very clear how the module was going to be set out. There was a nice structure to that, with lectures being released on the Friday, having some leeway as to when you could engage with those lectures, having the weekend if you wanted to, which works really well for me as a clinical academic, because I do work on my weekends as well. Sometimes that's how I have to fit my work in. And it was nice just to have that, not pressure to work on the weekend, but appreciation that if I wanted to, I could, whereas as opposed to having the lectures released on a Monday, say. And then having the discussion board to answer questions that were asked in those lectures was just a really great place to be able to formulate your own thoughts, because I think it's okay thinking about things as you go, but actually having to put them into words and explain to others how you are understanding things was really helpful, and to also read how other people were experiencing it. And then to have the Q&A sort of at the end of the week after that to address any questions that had come up, I felt like it worked really well as a system. And we were able to take implementation science in little bite-sized chunks throughout the weeks and process it as we went and build on it. And as I said before, it's quite an academic subject. And I think without having that support to walk you through it, it would have been really difficult, and it can be quite overwhelming.
Okay, that's great to hear, Steph. Can you tell me a little bit more about how you think the module might help you in your future career?
Yeah, sure. So I'm undertaking a systematic review at the moment, looking into implementation of interventions of palliative care in the ICU. But I hope to, moving forward, put together my own complex intervention to improve palliative care in ICU. And I'll be using my systematic review along with some consensus methods and qualitative methods to take that forward. And part of that will develop towards my application for a PhD, where I will then hopefully work on the complex intervention. So learning about different models and theories just gave me an understanding of how I can process some of that data that I'm creating and combine those mixed methods in a structured way, that will actually be useful clinically going forward. It will actually help me to see how I can implement those interventions. And I think it would have been, I could have just been leading myself blind through creating a complex intervention, whereas now I'm going to have a better understanding of actually what I need to do to implement that intervention and to be able to evidence why I'm doing what I'm doing.
Thank you, Steph. And finally, do you have any tips or advice for prospective students?
I think following the guidance of the structure is really beneficial. As I just spoke about that setup, right at the start, you suggested that we go through and sort of plan our months of the module and put in our diaries when the lectures are, when we think we'll be able to go back and watch them, put in some time for the discussion board and the Q&As. And doing that ahead of time meant that there was no thinking as I had to go through. I sort of looked at my calendar and thought, right, this is what I'm doing now. And balancing clinical work and academic work is a challenge in itself, and so it was really nice to have that advice to set that out beforehand, and I would highly recommend that people do that. Get involved in the discussion board. It's so valuable. I think especially with distance learning after COVID, it's very easy to be quite detached with these modules and think that you can sort of just watch the videos and get on with it yourself, but it's such a valuable part of it. I think getting involved is the best way to learn and hear what others are sort of processing things as well.